Hello, and welcome. Today we're diving deep into a condition that can impact both hearing and vision, temporal bone fracture affecting the middle ear. This seemingly straightforward injury can have complex consequences, and we're here to break it down for you. Let's start with what causes it. A temporal bone fracture, as the name suggests, occurs when there's a break in the temporal bone, the bone located at the side of the skull that houses the middle and inner ear. This is usually the result of significant blunt force trauma to the head. Common causes include car accidents, falls, assaults, and sports-related injuries. The severity of the fracture, and therefore its impact on the middle ear, depends on the force of the impact and the specific location of the fracture line. Now, let's talk about what happens inside when a temporal bone fracture affects the middle ear. The fracture line can disrupt the delicate structures within the middle ear. This can lead to several problems. Dislocation or fracture of the ossicles, those tiny bones responsible for transmitting sound vibrations. Damage to the tympanic membrane or eardrum. Bleeding within the middle ear space, known as hemotympanum. And importantly, potential damage to the facial nerve, which runs through the temporal bone and controls facial expressions. All of these can contribute to hearing loss, dizziness, and other complications. While precise numbers are difficult to obtain, temporal bone fractures are relatively uncommon, accounting for a small percentage of all skull fractures. They are most frequently seen in younger adults, primarily due to their higher risk of traumatic injuries. Understanding the demographics can help healthcare professionals better identify and manage these cases. The signs and symptoms of a temporal bone fracture affecting the middle ear can vary, but some are more common than others. These include hearing loss, which can be conductive, sensorineural, or mixed, tinnitus or ringing in the ears, vertigo or dizziness, facial paralysis, weakness or asymmetry, bleeding from the ear or otorrhea, bruising behind the ear known as Battle's sign, and cerebrospinal fluid leakage from the ear or nose, which is a serious sign indicating a dural tear. If you experience any of these symptoms after a head injury, seek medical attention immediately. Diagnosing a temporal bone fracture typically involves a thorough physical examination and imaging studies. A CT scan of the temporal bone is the gold standard for visualizing the fracture line and assessing the extent of damage to the middle and inner ear structures. An audiogram, or hearing test, is used to evaluate the type and severity of hearing loss. The doctor may also perform other neurological exams to check for facial nerve damage or other neurological deficits. Temporal bone fractures are broadly classified based on the direction of the fracture line. The two main types are longitudinal and transverse fractures. Longitudinal fractures are more common, accounting for about 70–90% of cases. They typically run parallel to the long axis of the petrous bone and are more likely to cause conductive hearing loss. Transverse fractures run perpendicular to the long axis of the petrous bone and are more likely to cause sensorineural hearing loss and facial nerve paralysis. There are also mixed or complex fractures that combine features of both types. Treatment for a temporal bone fracture depends on the severity of the injury and the presence of complications. In many cases, conservative management is sufficient, involving observation, pain control, and antibiotics if there's a risk of infection. More severe cases may require surgery to repair the ossicles, repair a dural tear, decompress the facial nerve, or address other complications. Hearing aids or other assistive devices may be necessary to manage hearing loss. Physical therapy can help with balance problems and facial paralysis. Preventing temporal bone fractures primarily involves preventing head injuries. This includes wearing seatbelts in cars, wearing helmets during activities like biking, skiing, and construction work, and taking precautions to prevent falls, especially in older adults. Promoting safe driving practices and addressing risk factors for falls can significantly reduce the incidence of these injuries. The prognosis for a temporal bone fracture varies depending on the severity of the injury and the presence of complications. Many people recover fully with appropriate treatment. However, some may experience permanent hearing loss, facial paralysis, or balance problems. Recent research is focusing on improving imaging techniques to better visualize the fracture and its impact on surrounding structures, developing more effective surgical techniques for repairing damaged structures, and exploring new therapies to promote nerve regeneration after facial nerve injury. The goal is to improve outcomes and minimize the long-term consequences of temporal bone fractures.